Imagine taking a pill for a headache, and within minutes the pain fades. But what if I told you that pill had no active ingredient at all? No medicine, no chemicals, just sugar or starch, and yet your pain goes away? That's the strange and powerful world of the placebo effect, a phenomenon where belief alone triggers real healing. Today on Issues Uncovered, we're exploring the fascinating psychology behind how the brain can fool the body, and why this so-called fake medicine might actually be one of the most effective tools we have. The placebo effect is one of the most baffling and well-documented phenomena in all of modern science. A placebo is something that looks like a real treatment, but isn't. It could be a sugar pill, a saline injection, or even a fake surgery. But what makes it so shocking is that people often get better anyway. Their pain lessens, their symptoms fade, their anxiety calms, all without any active medication. And what's even more surprising is that these aren't just people imagining they feel better. Brain scans show actual changes. Endorphins released, dopamine increased, stress hormones reduced, and pain signals dampened. So how can something biologically inactive produce such real, measurable changes in the body? The answer lies in the power of belief and expectation. When we think we're being treated, our brains start preparing for healing. Just the act of taking a pill, especially in a clinical setting, especially with a doctor's authority, can cause the brain to trigger its own internal pharmacy. It's not magic, it's psychology and neurobiology. The brain, expecting relief, begins to release chemicals like endorphins and dopamine, activating the body's natural healing systems. And in some cases, these systems work almost as well, or in rare cases even better, than actual medication. It's not that the sugar pill itself is powerful, it's that our belief in it is. This is why, in modern drug trials, new medications are always tested against placebos. It's not enough to show that a drug works. It has to work better than a placebo, because belief alone can cause real improvements. That's how strong the placebo effect is. In fact, some drugs fail clinical trials not because they don't work, but because the placebo group improved so much that the difference wasn't statistically significant. And this effect doesn't stop at pills. In one famous study, people with knee pain were split into two groups. One got real arthroscopic surgery and the other got fake surgery where incisions were made, but no procedure was performed. Months later, both groups reported the same reduction in pain. The belief that they had been operated on was enough to create real physical improvement. So what's happening in the brain during all this? The answer lies in how we process meaning and expectation. When someone takes a pill or undergoes a treatment, they're not just swallowing a substance, they're entering into a ritual. They're interacting with symbols of healing, doctors, hospitals, white coats, even the color of the pill. All of these factors send powerful signals to the brain that help is on the way. And in response, the brain activates the same networks involved in real drug responses, particularly the prefrontal cortex and the reward system, including the nucleus accumbens, which is involved in dopamine release. It's like the brain is saying, "We're healing now," and then follows through. But the placebo effect isn't just about brain chemistry. It's also shaped by culture, past experience, and even marketing. Studies have shown that red or orange pills are more stimulating, blue pills are more calming, and capsules are perceived as stronger than tablets. People tend to trust name-brand medications more than generics, even when they're identical, and often feel better just because they paid more. In fact, in one study, participants reported greater pain relief from a fake 250 pill than from a fake 0.10 pill. It's not about the substance. It's about the story we tell ourselves when we take it. And yet, for all its power, the placebo effect isn't a magic bullet. It works best for subjective symptoms, things like pain, stress, insomnia, fatigue, and mood disorders. It's less effective for diseases with clear biological markers, like infections, cancer, or broken bones. A sugar pill won't kill bacteria or shrink a tumor, but it might help someone feel less nauseous, more hopeful, or more energetic during treatment. And sometimes those things matter just as much for quality of life. There's also a darker side to this phenomenon known as the nocebo effect. This is when negative expectations create negative outcomes. If someone believes a treatment will cause side effects, they might actually experience them, even if the treatment is fake. In one study, patients were told a drug might cause headaches. The drug was a placebo, but many of them still developed headaches. The mind isn't just capable of healing, it's capable of creating suffering too, based solely on fear or belief. All of this raises a difficult ethical question. Should doctors use placebos if they make people feel better? Traditionally, this was seen as unethical. After all, it involves deception. But recent studies suggest that even open-label placebos, where patients are told up front that the treatment is inactive, can still work. One such study involved patients with irritable bowel syndrome. They were told the pills they were given contained no active medicine but might help anyway. Surprisingly, many reported real symptom relief. It seems that the ritual of care, the act of being seen, heard, and treated, can itself be therapeutic, even when the treatment isn't real. This opens up a whole new way of thinking about medicine. Maybe it's not just the chemicals that matter, but the experience. Maybe healing is as much about empathy, trust, and hope as it is about pharmacology. In fact, some doctors and researchers are now advocating for medical care that leverages the placebo effect in ethical ways. That could mean enhancing patient-clinician interactions, using positive framing when discussing treatments, or even integrating open-label placebos for conditions where the placebo response is known to be strong. The placebo effect also forces us to confront an uncomfortable truth. Our minds are not separate from our bodies. What we think and believe can change how we feel, how we heal, and even how we live. And that has implications far beyond the doctor's office. You can see the placebo effect at work in sports, where athletes sometimes perform better after taking what they believe is a performance enhancer, even if it's just sugar water. You see it in energy drinks, where people feel more alert even when they're drinking caffeine-free versions. You see it in luxury goods, where a high price tag can actually change how we perceive value, pleasure, and satisfaction. In the end, the placebo effect reminds us that healing isn't just about the substance, it's about the story. The story we tell ourselves when we take a pill, the story we hear from a doctor we trust, the story we believe about our ability to get better. And sometimes belief is enough. Not always, not for everything, but enough to matter. So next time you take a pill, consider this: how much of what you feel is caused by the chemistry, and how much is caused by your belief in the chemistry. It doesn't mean medicine doesn't work. It means the mind is part of the medicine. And sometimes belief is the most powerful drug of all. Thanks for watching Issues Uncovered. If you found this episode thought-provoking, hit that like button, subscribe, and ring the bell so you don't miss future deep dives into the hidden forces that shape our minds and our world. And let us know in the comments, have you ever experienced the placebo effect? Or maybe the nocebo? Your story could be someone else's insight. Until next time, stay curious, stay skeptical, and keep uncovering the issues that matter.